For decades, the American government has been trying to reform its healthcare. However, it has been unsuccessful. Every 15 years or so, proposals to reform the entire U.S. healthcare system seize national attention. The cycle has endured since President Franklin D. Roosevelt considered proposing universal health coverage as part of the Social Security Act. Presidents Truman, Carter, Ford, George H.W. Bush, Clinton, George W. Bush, and Obama all produced proposals for universal coverage. Though different in detail, they shared one key characteristic: failure. Each time, supporters of reform believed popular demand would drive elected officials to end the national embarrassment of millions of uninsured and rein in health expenses that were needlessly high and bought less than they should. Each time, reformers were right in their accusations and wrong in their political judgment. Before President Barack Obama signed the Patient Protection and Affordable Care Act in March 2010, the United States was the only wealthy, industrialized nation that did not provide some form of universal health care. 2 decades ago, the Clinton administration proposed a health care plan. The plan required each U.S. citizen to become enrolled in a qualified health plan and prohibited their disenrollment until covered by another plan. It proposed the establishment of corporate regional alliances of health providers to be subject to a fee-for-service schedule. People below a certain set income level were to pay nothing. Opposition to the plan was heavy from conservatives, libertarians, and the health insurance industry. Democrats, instead of uniting behind the president's original proposal, offered a number of competing plans of their own. By September 1994, the final compromise Democratic bill was declared dead. In 2007, President George W. Bush proposed a health care plan during his State of the Union address. It laid out a plan intended to make health care more affordable, give everyone who buys insurance the same tax break, and encourage you to be more aware of your costs and how you spend your healthcare dollar, and all without increasing federal spending.
To build a future of quality health care, we must trust patients and doctors to make medical decisions and empower them with better information and better options. We share a common goal: making health care more affordable and accessible for all Americans. This one reform would put private coverage within reach for millions, and I call on the Congress to pass it this year.
However, some were concerned that employers may decide to stop offering health care plans at work and just give money to employees to buy insurance on their own. That made it harder for less healthy individuals to buy affordable coverage because they are not as desirable to insurers as healthy people, and some of those healthy people may decide to give up coverage altogether if it's not a default offering at work. The most recent attempt for healthcare reform was when President Barack Obama signed the Patient Protection and Affordable Care Act in March of 2010. This law includes numerous health-related provisions to take effect over a 4-year period beginning in 2010. The provisions included that health insurance providers are mandated to provide insurance to all citizens with no denial of coverage based on pre-existing conditions, expansion of Medicaid entitlement, financial aid for the working poor to make healthcare coverage more affordable to them, incentives for businesses to provide health insurance benefits, and additional support for medical research.
No one's taking that away from you. 3 months from now, 6 months from now, you're going to look around, you're going to be sitting in a doctor's office reading through the old people magazines. You'll say, hey, same doctor, same plan. It wasn't Armageddon. What this reform does is build on the system of private health insurance that we already have. So does that mean that it's going to solve every healthcare problem that we have? No.
However, the plan has its downsides. Health insurers worry that if they're forced to cover all children regardless of health conditions, higher rates will result, because only the families of sick kids would apply. The plan would call for higher taxes. Also, state-run health care plans for low-income citizens would be terminated. Finally, opponents of the CARE Act claimed it would be ineffective and it would not solve any problems.
repealing it.
This health care bill will ruin the best health care system in the world, and it will bankrupt our country.
So you'll take a vote on repealing it?
We are going to repeal Obamacare and replace it with common sense reforms that'll bring down the cost of health insurance.
Well, obviously, if there's 40 million plus people in America without health insurance, then it just goes to show that there's something wrong with the system. The American people, a lot of them are going bankrupt trying to pay for their health care bills, and the country is wasting their money giving money to health insurance companies and to people who can't afford it, that they're just wasting their money, and that there's something wrong with it. Well, what you're seeing is like a domino effect. In these economic downtime, people are like losing jobs. They just can't afford healthcare anymore. So what they do is they ask the country, America, for money so they can have some health insurance. But on top of that, the country's already in debt. So if they have to keep giving more and more people money for health insurance, it's just going to drive us more into debt. So, and on top of that, at the same time, the cost for medications, hospitalizations, the doctor wages, all that is growing every single year. So it takes more and more money for the country to pay for that. And not just the country, but health insurance companies, they also have to raise their premiums, their prices, the prices for their plans, just because there's less and less people in their companies buying insurance. So the people who are already there, they just start losing that assurance of being covered because they can't pay for it anymore. I think for America to solve some of its healthcare problems, I think they should take programs like Medicaid and Medicare that help poor people and senior citizens. Make a program like that, but make it so that any citizen in America can access it, but still leave the option for them to buy a private plan from private insurance companies, so that if they're not satisfied with the government's coverage or plans, they can have their own if they can afford it. Also, another thing they should do is promote businesses, give businesses incentives and tax breaks for companies that give their employees coverage as a automatic thing when they apply to work. so that a lot of companies do it and people don't have to buy their own or depend on the government, because it saves the government more money.
I see it around me, I see it in everything. I could be so much more than this. Said my goodbyes, this is my sundown. I'm gonna be sad.